expanding to the surface area.
Yes, it's the surface area issue, right? So when they were flat, right, and that surface area was reduced, and when they wake up in the morning, all that accumulation, all that inactivity during the night, it kicks in the morning, and it causes that stress on the body. And now they got to bring up all that coughing, all that restriction, all of that just is triggered more in the morning because of the position they were laying, the accumulation of the mucus, all of that happens early in the morning. So that's something to note as well. Okay, so let's talk about how do we compare asthma to pneumonia? So you could tell me like ways they're similar, or you can tell me ways they're different. So I'm gonna go to each section. So someone here, tell me whichever one, different or similar. Go.
Similar, poor oxygenation.
Yes, poor oxygenation, similar. So someone from here. Similar or dissimilar? We're comparing asthma and pneumonia.
You cough in both ways?
Yeah, cough in both of them. That's right, right? We cough in asthma, we cough in pneumonia. Great job, yeah. This section, similar, dissimilar.
Pneumonias are from pathogens.
Yes, I love that. Pneumonia is a bacterial something. Asthma is not. Good job. Someone here.
Chronic versus acute.
Yes, right? So pneumonia, right? We get it today. It's cleared. It never bothers us again. They're never going to tell me I was diagnosed with pneumonia unless I told them, right? They won't know, right? But asthma, once you're diagnosed, and it gets chronic. It gets worse, and eventually, that's your life. Some people, they have to travel with oxygen pumps because their pneumonia is so bad, right? You won't get that in pneumonia, right? In pneumonia, if it gets super, super bad, you're just not gonna make it, God forbid, right? But yeah, that's a great one. Someone here, something similar or dissimilar?
They both cause inflammation.
Yes, that's right. They both cause inflammation.
I actually have a question.
Yes.
So, contrast to pneumonia and asthma, I know that pneumonia causes scar tissue in the lungs. Does asthma do that as well?
It can, because of the same inflammation, right? Because we said that's why we don't want the inflammation to come up and down, because anytime, when you think about trauma or damage, the healing process is what the scarring happens. So that tightness or the damage can cause scarring too. And then when we say the person who carries the oxygen pump with them, there's so much scarring from the inflammation that happened all along so many years that it never gets back to normal. Yes. Thank you.
Yeah, that doesn't heal then, right? For asthma, let's say it's gonna stay there.
If the person gets to that level, they might not have attacks where like the chest tightness, the coughing, but the damage to the lungs, once it's done, you can't get that back, right? So that's why for the rest of their lives, they'll carry oxygen. Like, I don't know if you've seen people like that, but they have the little packs, right? It could be emphysema, it could be, but it's some damage that happens that is traumatic, right? So it can happen. Okay, so now let's talk about how are the problems manifest the same or different. So we kind of mentioned, let's specifically talk about problems, right? What are the problems that are same or different with asthma and pneumonia? Let's start with that section again. Problems, specifically problems. Yeah, Miguel is like, somebody other than me. I said the last one.
Come on, Miguel.
No, he already spoke, so he's like, somebody else.
Well, I'm not gonna lie, I was kind of spacing out for a second, so I was like, questions.
So the problem is, what are some of the problems that are the same that you'll see a person with asthma or a person with pneumonia? Okay, think about it. Let's come to this section. What are some, not the person who spoke last. Fatigue, yes. Why are they fatigued? Is that similar or? Similar, yes. Why are they fatigued?
They're not getting enough oxygen.
Yeah, oxygen is energy. So since both of them are not getting energy, we're going to have fatigue. We have activity intolerance, that kind of thing. That's a great one. Problems.
Pneumonia's crackles and asthma is wheezing.
Yes. Awesome. Pneumonia is crackles because of the fluid. And asthma is wheezing because it's the spasm, the tightness. Great one, great one. How about you guys? Oh, by the way, even though I say great for this one, great, they're all great. I feel like I'm giving you much more greatness. Go ahead, guys. Who's gonna enter?
Increase CO2?
Okay, yes, is that for both or that's just one?
I'm saying for both.
Yes, it is for both. Great job. So yeah, because pneumonia, right? If the person's not breathing properly, they're not coughing, the CO2 can get trapped too. And asthma, same thing. The tightness causes the CO2 to go. So both of them have respiratory acidosis. Yes, Kian. Good job. Good job. Okay, this section. Yeah, great. Good job. Yes. A problem that's same with both. Tachycardia, yeah. Is that with both or? Both, yes, tachycardia. And why are we having the tachycardia again?
Because they're struggling to breathe.
Yes, they can't breathe, so the body's saying work harder. Yeah, good job, good job. Okay, third one. Compare and contrast the nursing intervention for both. Okay, so we know the problems. What can we do for one or the other or for both? Nursing intervention, section, over there. Not Miguel. Somebody else. Come on, guys. You got this.
I can help with their breathing.
Yeah. Yes, so breathing exercises. I love it, right? If they don't know how or they're too tired, well, then we can train them like, okay, breathe in and out. And all right, or we can give them, yeah, I love it. I love it. I won't go any further because somebody might say something else. Good job, Laura. Thank you. Next section, interventions that we can do that's the same with both or different.
Give meds as prescribed.
Yes, give meds as prescribed, but you can't get away with that easily. What medication? Yes, is that for both or that's for just one? Yes, good job. Love it, love it. So definitely medication, both of them are going to get medication, right? And the bronchodilators, right? Because the asthma, if they're not breathing properly, we definitely can give them bronchodilators so we can open it up more so that they can breathe better. And definitely doing the asthma as well. Awesome. Someone in this section, a problem for both. And you guys can talk to each other. Yeah, like help each other out. It's cool.
Antibacterial pneumonia.
Okay, with antibacterial pneumonia, what does that mean? Tell me more. What is that?
To clean, to get out the gunk.
Okay, so we're giving antibiotics is what you mean? Yes, yes.
That's what I meant.
That's what you meant. I know that's what you meant. So we're going to give antibiotics in pneumonia, but are we going to give antibiotics in asthma? No, because it's not a bacteria problem. Now, if an asthma patient develops pneumonia, they might get antibiotics even though they have pneumonia because they had an infection on top of it. Because the asthma might make them more at risk, right? We'll see that. COPD patient, asthma patient, when your lungs are already weak and struggling and have problems, it's easier to catch something, right? But technically speaking, yes, asthma patients don't get antibiotics, but pneumonia patients do. Great. How about this section? Somebody tell me. What are we going to do?
Give O2.
Give O2. Do we give that for both or just one? Both. That's right. Right? That is an intervention. We want to give O2. Let's go a little further. When would we give O2? Just because you have pneumonia, here's some oxygen. You have asthma, here's some oxygen. If the stats decrease, right? We want to see the measurements. We want to see lower than 95% O2. Right? Then we know we have to give oxygen. Or if they're in distress, right? Sometimes we don't need to measure. We see accessory muscles, right? We're going to measure, but we're like, okay, let's give them oxygen, right? Or they're doing some activity and they're starting to desat and they're starting to, like, they look like they're passing out. Yeah, we're going to assess whatever the numbers are. So depending on what we see, it can help us think, okay, I got to get the oxygen ready. Let me measure to see what I need to do. So great job. Yeah. Over this side, what are some other interventions? Yes, chest percussions. Which one are we doing it for?
Both.
Yes, both. Now, wait. Tell me why. Why are we doing it for the asthma one?
To help with the mucus.
Yes, and why are we doing it for the pneumonia one?
Same thing for the mucus.
It's the mucus, but more like for fluid too, right? right? So it's both really. So, but definitely, it's the mucus. We want a chest PT. If they're having problem coughing off mucus, definitely, right? But also the pneumonia, right? The changing positions will help the fluid kind of rotate positions and get reabsorbed back up. But the antibiotics will definitely help that as well. Great job, great job. You guys are doing great with this. Awesome, awesome, awesome. Okay, so here's some other differences that we were talking about. Asthma versus pneumonia. So we have causes of the shortness of breath, right? Both of them have shortness of breath. Then we have causes cough. Both of them have cough. We have cause an increase in pulse rate. Both of them. Causes an increase in respiratory rate. Both of them. Causes fever. Just the pneumonia. Why is that again? The infection, right? Causes wheezing, whistling sound. Asthma, why is that again? The restrict airways, that vasospasm, definitely. Okay? Causes a crackle, someone mentioned this one too. The fluid, yes. So remember what crackles are, right? So crackles are, when you have like a drink, and kids, or I don't know, adults might do it too, who knows? And you have the straw, and then you blow in the straw, and the air goes down to the bottom and comes back up and pop. Those are crackles. So it's the air going into the lungs, hitting the fluid in the alveoli, coming back up and popping on top. That's what we're hearing, right? And so that's why we have that there. It's the fluid. Can be managed with treatment. Both of them can be managed with treatment. And we talked about some treatments, right? We said medication. We said, no one mentioned lifting the bed up, right? Repositioning, right? No one mentioned make sure they're ambulating, right? No one mentioned clustered care. All the things that we mentioned when we talk about oxygenation in general, we're going to do here too, because this is an oxygenation problem, right? And can be cured. Someone mentioned this, right? Pneumonia can be cured, but asthma cannot. You have asthma once, you always have asthma. Okay, so with the 15 minutes we have left, let's do a case study. So get within your groups and go ahead and read this, and you have questions on the side. Let's do it. Yes, thank you, Miss Hannah, for coming to join us.